Do you frequently feel like your heart is pounding when you're in a crowded mall or on a busy bus? Maybe you start sweating, feel dizzy, or want to run away fast. That could be more than just stress. It might be agoraphobia. Agoraphobia isn't just disliking crowds. It's a strong fear of being in places where escape feels hard or help might not be available if something goes wrong, like having a panic attack. For example, Maria, a 28-year-old teacher, used to love shopping. But after having a panic attack in a supermarket, she started avoiding stores, buses, and even outdoor markets. Now she feels trapped at home. That's agoraphobia, fear that changes your life and keeps you from living fully. So, why does someone develop agoraphobia? It often starts after repeated panic attacks. Think of it like this. Imagine you get shocked by a toaster once. After that, you might fear all kitchen appliances, even the microwave. Your brain links certain places with danger. In agoraphobia, the brain starts connecting open or crowded spaces with panic. Genetics can play a role. If a family member has anxiety, you may be more at risk. Trauma, like being stuck in an elevator or being in an accident, can also trigger it. Also, people who are more sensitive to stress or who avoid scary situations instead of facing them may slowly build up fear over time. It's not just being shy. It's a mix of biology, experience, and learned behavior. How do you know if it's more than just nervousness? Key signs include panic symptoms like fast heartbeat, sweating, shaking, or feeling like you're choking, but only in certain places. For instance, Tom feels normal at home, but as soon as he enters a movie theater, his chest tightens and he thinks, "I can't breathe, I need to leave now." Other signs: avoiding elevators, public transport, lines, or open spaces. Some people need a trusted friend to go out with them. Others stop leaving home altogether. They may also feel extreme fear of losing control or going crazy. It's not laziness, it's fear so strong it controls their choices. Ask yourself, do I avoid places because I'm afraid something bad will happen and I can't escape? If yes, it might be agoraphobia. There's no blood test for agoraphobia, but doctors use honest conversations. A doctor might ask, where do you feel unsafe? When did this start? What happens in your body when you're scared? They check if panic attacks and avoidance have lasted more than 6 months. The goal is to understand your story. Treatment works well. Cognitive behavioral therapy, or CBT, is a top choice. It's like retraining your brain. For example, Anna worked with a therapist to slowly face her fears, first standing outside a bus stop, then riding 1 block, then 5. She learned to say, "I'm safe, even if my heart races." Medicines like SSRIs can help calm the brain's alarm system. The mix of therapy and support brings hope. Most people improve over time with help. Can you prevent agoraphobia? Yes, especially if you catch fear early. Imagine fear is like a small weed. Pull it early, it's easy. Wait too long, it takes over the garden. If you notice panic attacks or start avoiding places, talk to someone early, a doctor, counselor, or even a trusted friend. Practice facing fears in small steps. For example, if crowded streets scare you, start by walking near a busy sidewalk for 2 minutes, then 5, then 10. Breathe slowly, 4 seconds in, 6 seconds out to calm your body. Build confidence like muscle, little by little. Staying connected with others, exercising, and managing stress also protect your mental health. Prevention isn't about never feeling scared. It's about not letting fear drive. New research is bringing fresh hope. Scientists are studying virtual reality VR therapy, using headsets to safely visit scary places like airports or stores, all from a therapist's office. It's like a flight simulator for fear. One study showed people using VR faced their fears faster and with less dropout. Also, new brain scans show how agoraphobia affects areas linked to fear and safety. This helps create better treatments. Apps that guide breathing and track panic patterns are also being tested. Some researchers are even exploring how gut health might affect anxiety. Science is moving fast, and the message is clear: healing is possible.